Mr. President. Mr. President and distinguished colleagues, I rise today to sponsor Senate Bill number 1869 under Committee Report number 28 entitled An Act Creating the Philippine Center for Disease Prevention and Control, defining its powers and functions, appropriating funds therefore and for other purposes, which is the output of the Subcommittee on Center for Disease Control that I chair. These are we had quite a few bills filed under this measure under this committee report. These are Senate Bill number 12 filed by this representation, SBN 195 Senator Go, SBN 544 Senator Po, SBN 600 our Senate President, Senate Bill 825 Senator Gatchalian, Senate Bill 1039 Senator Escudero, Senate Bill 1113 Senator Lagarda, Senate Bill 1163, Senator Ejercito, Senate Bill 1427, Senator Revilla, Senate Bill 1477, Majority Floor Leader Villanueva, and also taking into consideration House Bill number 6522 by Reps Gato Romualdez et al. This measure is also known as the Philippine Center for Disease Prevention and Control Act. Mr. President, it's been 3 years since the country recorded its first COVID-19 case, specifically on January 21, 2020. The COVID-19 pandemic has exposed the fragilities and gaps in the healthcare system around the world. It posed a great threat to countries with weaker health systems. During these 3 years, we realized the importance of strengthening our healthcare system to protect Filipino families from existing and emerging public health emergencies that could present a threat to our lives. If there's one lesson we learned from this, it's the importance of being prepared for our future crisis, including the possibility of another pandemic. According to the Center for Global Development, there is a 47 to 57% chance of another global pandemic as deadly as COVID-19 in the next 25 years. As a background, I also sponsored this priority legislative measure last Congress, but DOH still wanted to study it further. Thus, the bill we have today is a product of hearings and ongoing consultation that extended even till the last minute. These are the salient features of the said measure. CDC, under the Department of Health's Office of the Secretary, will act as the technical authority on forecasting, analysis, strategy, and standards development for the prevention and control of all diseases of public health importance and health security events, whether domestic or international in origin. The function of the CDC shall include, but not limited to, the following: develop strategy, standard, and policies for disease prevention and control, implement disease surveillance and field epidemiology activities, perform data collection and analytics, establish and strengthen public health laboratories, recommend actions for public health threats to appropriate national government bodies, lead public health and risk communications, conduct and manage health research and evidence synthesis, build local capacity for surveillance and health research, and promote scientific integrity by ensuring that all its products are technically accurate, scientifically and ethically sound, and useful to the government and the intended population through the institutionalization of appropriate mechanism and bodies. The Research Institute for Tropical Medicine, otherwise known as RITM, as a whole, will be a whole body under the CDC. For those who have followed the discussions on RITM and the CDC, sa madaling salita, hindi na po ito chop-chop. Take note that the Majority Floor Leader is smiling, is grinning. Hindi na po ito macha-chop-chop as was originally presented to us. RITM will still be a whole body, but now under the CDC. So instead of its various divisions being absorbed, RITM as a whole, I repeat, as a whole, will be under the CDC. And RITM, dear colleagues, will now be referred to as the Philippine Research Institute of Medicine. Why? Because RITM stands for Research Institute of Tropical Medicine. We have gone past that, and thus we need to rename RITM. But given all its accomplishments, we fought very hard for them to be retained as a body. So RITM, now known as Philippine Research Institute of Medicine, shall continue to perform its current function through its Clinical Research Division, Laboratory Research Division, and Biological Manufacturing Division. Perform expanded functions involving infectious and non-infectious diseases, specifically on health evidence and health laboratories. Work together with the other centers of the CDC, namely the Center for Health Statistics and the Center for Surveillance and Epidemiology. Through this measure, we aim to adopt a framework that fosters a whole-of-system, whole-of-government, and whole-of-society approach that would streamline science-based decision-making and policy-making, especially during public health emergencies. The function of RITM and the other centers were also harmonized with the existing offices and units within the DOH. Mr. President, globally, nations are scrambling for solutions to end the pandemic and defeat the virus, but COVID is not the only health threat out there. As chairperson of the Senate Committee on Sustainable Development Goals, Innovation, and Futures Thinking, it is my duty to ensure that we are on track with our targets under the SDG, including SDG 3 on good health and well-being. One of the targets under SDG 3 is to strengthen the capacity of all countries, in particular developing countries, for early warning, risk reduction, and management of national and global health risks. This is SDG 3.D. Now more than ever, we need to invest in our healthcare system to prepare us better for other possible health emergencies and to help us build a more sustainable future beyond COVID-19. Dear colleagues, before I end, I'd like to point out that there will be high-level scientists in CDC and many others who will be participating either as consultants, as advisors, and one of the key provisions of this measure is to consider exempting them from the standard salary grades. We all know, and there are enough news reports that tell us and show us how many of our healthcare workers are leaving the country because of the demand and the very lucrative promises that are being offered to them. And it is their right. It is the right of our health workers to decide where they want to set up home, where they want to have a living. But we can do our part, dear colleagues, by strengthening our healthcare systems and improving the benefits we provide for them. And one good way to start, Your Honor, is through the CDC. With that, I will give you time to study the measure. We will be providing the body with a briefer, something like an FAQs to help digest this very technical bill, and then we will be ready to accept interpellations after the time that you will have to study the measure. Thank you very much, Mr. President.
Thank you, thank you. Thank you very much, distinguished colleague, Senator Pia Cayetano. Majority Leader.
Mr. President, may I be allowed to co-sponsor the measure, Mr. President?
Oh, yes, we'd like to recognize the distinguished Majority Floor Leader from the great province of Bulacan, Senator Joel Villanueva.
Thank you very much, Mr. President. Mr. President, dear colleagues, it is this representation's honor and privilege to co-sponsor Senate Bill number 1869 under Committee Report number 28, creating the Philippine Center for Disease Prevention and Control, or CDC, one of the priority measures of this administration. In fact, Mr. President, this was also subject of our pre-LEDAC meeting held this morning together with the Senate President, Senator Subiri, Senator Loren Legarda, our Senate President Pro Tempore, Senator Sani Angara in this representation. Mr. President, recognizing the importance of strengthening our healthcare system to protect our people from current and emerging health emergencies, this representation also filed Senate Bill number 1477, which is one of the measures considered in the committee report. Again, let me take this opportunity to commend and thank the sponsor, Senator Pia Cayetano, for working very, very hard on this very, very important piece of legislation. Mr. President, it has been 3 years since our country recorded its first COVID-19 case. Since then, the total number of confirmed cases in the Philippines has reached more than 4 million, while the reported death toll to the virus is now at more than 65,000. The pandemic has also driven the country to its worst economic performance since World War II, with gross domestic product falling by 9.5% in 2020. About 4.5 million Filipinos have lost their jobs in the same year, with unemployment rate skyrocketing to 10.4%, the highest in 15 years, Mr. President, due to the pandemic and lockdown measures affecting thousands of businesses. Mr. President, we do not want a repeat of this in the future, in our future. Our people have suffered enough. We have seen the necessity of strengthening our healthcare system to ensure that massive loss of lives and jobs will no longer happen should we experience another health emergency of this scale. We need to be prepared, as a new study which appeared in the proceedings of the National Academy of Sciences of the United States of America found that the probability of a pandemic with a similar impact to COVID-19 is about 2% in any year, and the probability of experiencing a pandemic similar to COVID-19 in one's lifetime is about 38%. Mr. President, we need to immediately pass this measure which seeks to establish the Philippine CDC. The agency under the Department of Health's Office of the Secretary shall be the technical authority on forecasting, analysis, strategy, and standards development for the prevention and control of all diseases of public health importance and health security events, whether domestic or international in origin. A whole of system, whole of government, and whole of society approach anchored on science-based decision-making during public health emergencies is aimed to be adopted through this measure. Mr. President, sabi nga po nila, health is wealth. We need to put in place measures to ensure that what happened in the past 3 years, loss of lives, loss of jobs, loss of income because of global pandemic does not happen again. COVID-19 remains a threat. We are still reeling from its impact, and the last thing we need is to be caught unprepared to address another public health emergency in the future. It is high time that we invest in our healthcare system to promote and protect the health and well-being of our fellow Filipinos. Again, we thank our sponsor, Senator Pia Cayetano, for prioritizing this bill. The good sponsor has our full support for the passage of this measure. Maraming salamat, Ginoong Pangulo, dear colleagues, and may God bless us all.
Thank you very much, Majority Floor Leader. And we really appreciate the work of Senator Pia Cayetano and Majority Leader on this particular issue. We were discussing on the side of the caucus earlier with Senator Cayetano how we're losing so much of our healthcare workers to other countries. Not their fault. All these countries are giving them all these benefits, but we have to figure out how we will not lose all our healthcare workers to other countries, not have any for our own.
Definitely, Mr. President, especially scientists, Mr. President. Mr. President, next to co-sponsor the measure is our Senate President pro tempore, Senator Loren Legarda. I move that she be recognized, Mr.
Our
President.
distinguished Senate President pro tempore, Senator Loren Legarda, is recognized. Ma'am?
Mr. President, my dear colleagues, it is my honor to co-sponsor the bill creating the Philippine Center for Disease Control and Prevention, defining its powers and functions for other purposes. As of February 11, 2023, a total of 4,074,563 COVID-19 cases have been confirmed in the Philippines, with 65,938 deaths as reported by the Department of Health. To this day, almost 3 years since the virus hit our country, news reports have disclosed that there is a slight increase in the number of people testing positive for the virus. In fact, it was reported that as of February 11, the nationwide positivity rate was at 13.6%. Previously, the World Health Organization had recommended a 5% rate or less to control the pandemic effectively. The onslaught of the pandemic highlighted the flaws in the Philippine healthcare system, exploiting the gaps in coverage, inadequate healthcare facilities, health disparities, and the country's inability to respond effectively in vulnerable environments. The Department of Health is continuously facing difficulties as a result of the COVID-19 outbreak. Amidst the outbreak of the virus, the DOH still had to manage other epidemics such as dengue and typhoid fever. Moving forward, it must be able to set up and adopt a robust healthcare system that can respond to the needs of the nation and other new health issues. The Constitution provides for the protection and promotion of the right to health of the people and the instillment of health consciousness among them. It also provides that the state is responsible for the adoption of, and I quote, an integrated and comprehensive approach to health development which will endeavor to make essential goods, health, and other social services available to all people at affordable cost, unquote. Hence, it is imperative that there be a national center for disease control and prevention that will steer and coordinate the government's response to address illnesses and other threats to public health. We have to adapt fast to the unfamiliar attributes of our new environment, as a global health emergency has now compelled us to live in the new normal. It has caused us to understand that our society, our economy, our current institutions are weaker and less effective than we had anticipated. Let us not wait for another outbreak to completely crack our already fragile and weak healthcare system. Instead, let us focus on sustainable reforms to effectively address ongoing and new issues in the health sector. The right of health to health of every Filipino must be protected by government. Everyone should have access to health services. The proposed policy will address not only the issues that COVID-19 has brought to our healthcare system, but also ensure that our healthcare system is equipped to monitor, forecast, and develop precautions to control diseases of either national or international concern. Mr. President, these are the reasons why I wish to associate myself with the proposed measure. With Senator Pia Cayetano's assent, I wish to be a co-sponsor of the measure. Thank you, Mr. President.
Thank you very much, my dear colleagues.
Thank
My
you,
dear
Mr.
colleague.
President. Mr. President, next to co-sponsor the measure is our Deputy Majority Leader, no other than Senator J.V. Ejercito. I move that he be recognized, Mr. President.
Our distinguished gentleman, Senator from the city of San Juan, Senator J.V. Ejercito, is recognized, sir.
Thank you, Mr. President. My dear colleagues, it's an honor and privilege to co-sponsor Senate Bill number 1869, otherwise known as the Philippine Center for Disease Prevention and Control, under Committee Report number 28. Resilience is never a bad thing. However, it can only be achieved if we learn how to adapt to the situation and challenges brought before us. The pandemic has exacerbated the weakness of the Philippine healthcare system, and so does the rest of the world. No one has ever predicted the advent of COVID-19. Mr. President, good thing for our country, when the pandemic came, the Universal Healthcare Act was already being implemented. This law that we passed during the 17th Congress came just in the right time. Somehow, the UHC, even on its infancy, has cushioned the physical and economic damages caused by the pandemic. To defeat the coronavirus, our country needs all the help it can get from everyone, its own people and its government. Our people, most of the time during the height of the pandemic, has cooperated with quarantine protocols. The government did what it had to do to distribute financial aid to ensure economic survival. But now more than ever, prevention is indeed better than the cure. The COVID-19 pandemic has forever changed the way governments respond to a health crisis. Everyone has caught off guard. Not even the wealthiest of countries were able to immediately contain the spread of the virus. Most countries which decently curb the transmission of the virus and minimize its health and devastating economic effects has a strong foundation of institutions dedicated in handling infectious diseases. Japan, the United States of America, China, and the European Union have their own Center for Disease Control. Today, our country is given the opportunity to have our own. It is unfortunate, however, that everyone is well informed of the benefits that a CDC can bring. Some of those who oppose the passage of this bill express their fear that this is a measure solely about vaccination. The CDC is beyond vaccination. It is research and development of finding cures and finding ways to prevent diseases. Armed by the experiences we shared together with other countries and our own personal knowledge of fighting COVID-19, we seek to establish the Philippine Center for Disease Control and Prevention. The establishment of our own CDC shall prepare our country for whatever communicable or infectious disease that might come our way in the future. We will have an agency equipped with the information and guidance we need to fight and live through another pandemic. For these reasons, Mr. President and my dear colleagues, I implore this august body for the swift approval of this bill. Thank you, Mr. President.
Thank you,
very
Senator
much.
J.V.
To our distinguished colleague.
Yes, Mr. President, Senator Nancy Binay and Senator Sherwin Gatchalian would like their co-sponsorship speech be inserted into the records.
If I may also have mine
And
inserted to the records.
the speech also of Senator Jingo Estrada.
And the Senate
And the Senate President.
Thank you very
be inserted.
much.
Thank you, Mr. President.
take note.
This juncture, Mr. President, I move that we recognize to co-sponsor the measure is no other than the distinguished gentleman from Davao Region and Batangas Province, Senator Bongo. I move that he be recognized. Mr.
Our distinguished colleague from the great city of Davao, Senator Christopher Bongo is recognized.
Mr. President, it is my honor to co-sponsor the measure establishing the Philippine Center for Disease Control and Prevention. As chair of the Senate Committee on Health, one of my priorities is to make our healthcare system better prepared to respond to future public health crises. Aside from capacitating our health facilities, it is my firm belief that we need a sole agency focus on the prevention and containment of infectious diseases in light of the impact of the COVID-19 pandemic. I therefore thank Senator Pia Cayetano, Chair of the subcommittee under the Committee on Health, for reporting out this measure, establishing our very own CDC. It is very fitting that the one spearheading the passage of this measure is also the very capable Chair of the Committee on Sustainable Development Goals, Innovation, and Futures Thinking. Mr. President, the global outbreak of the coronavirus disease sparked the need to have a more comprehensive, proactive approach and multidisciplinary preparedness for the emergence and re-emergence of epidemics and pandemics. In other countries, Center for Disease Control have been instrumental in their COVID-19 response. They are considered as experts in the field of infectious diseases, which is why they are at the forefront of the battle against COVID-19. I believe it is high time for us to have our very own CDC. Former President Rodrigo Duterte acknowledges this and has previously urged Congress to pass this important measure. I am glad that the administration of President Bongbong Marcos Jr. also acknowledges the importance of this measure. Dapat one step ahead tayo. Hindi po pwede na hindi tayo handa kung mayroong paparating na mga kalamidad, sakuna o emergency. Sa bawat oras na nagkulang po tayo sa paghahanda, maaring buhay po ang maging kapalit. Alam naman po natin, Mr. President, na hindi natin masasabi kung mayroon pang pandemyang darating sa ating buhay. Sa kadahilanang ito, kaya kailangan nating maging proactive. Kikwento ko na lang po, sa preparasyon po ng budget ng RITM noong 2020, during the budget deliberation, December of 2019, nakita ko doon sa NEP, 118 million lang ang nilagay na budget sa RITM. Sa GAA naman po ng 2019, 198. So ibig sabihin, binawasan yung proposed budget, binawasan ng 80 million. Sino ba naman mag-aakala na yung RITM na opisina na binawasan po nila sa proposed budget, ang ahensyang mangunguna sa sa testing. Nung January, dumating yung COVID-19. Nalaman natin nung Marso, nandito na sa Pilipinas. Hirap na hirap nga tayo sa testing. Pinapadala pa sa Australia yung mga specimen at 1 week pa makukuha yung resulta through RITM. Sila po yung pinaka-importanting opisina nung panahon yon. Hindi natin akalain na yung panahon yon darating yung COVID-19 sa buhay natin. So the more na dapat natin silang bigyan ng pondo, now with the CDC, mas pinapalawig pa natin sila dahil magiging under po ng CDC ang RITM. Dealing with the diseases promptly and appropriately requires the reorganization and strengthening of the country's health units committed to preventing and controlling such diseases. With the establishment of our CDC, I am confident that the government will be better prepared to deal with any public health emergency in the future. It is for these reasons that I asked this chamber's support for the approval of this measure. Maraming salamat po, Mr. President.
Thank you,
Thank you
Senator
very much.
Bongo.
Thank you
Thank
very
you,
much,
Mr.
sir.
President. Mr. President, last but not the least, to co-sponsor the measure is the distinguished gentleman from the great province of Cavite, no other than Senator Ramon Bong Revilla Jr.
Our distinguished
I move that he
colleague,
be
Senator
recognized.
Ramon Bong Revilla Jr. is recognized.
Thank you, Mr. President. I laud the senator from Taguig Pateros, Senator Pia Cayetano, for championing this future-proofing measure of our health system. As one of the authors of the bill considered by the committee, I am fully cognizant of the role preparedness plays in times of crisis. Kaya buo po ang aking suporta sa panukalang magiging ating kalasag laban sa mga daluyong ng buhay. After all, if there is one thing we have learned from the pandemic, it is this: preparedness saves lives. Statistics don't lie. Tinatayang hindi ang COVID-19 ang pinakamatindi at lalong hindi ito ang huling pandemya na kaharapin natin. Learning from the lessons the pandemic has taught must be utilized moving forward, as that the lives lost in this war will not put to waste. Kung pahalagaan natin ang ating mga natutunan sa nagdaang pandemya, kahit papaano ay hindi sayang ang hirap at pagod ng mga siyentipiko at medical professionals sa pagtuklas sa mga susi upang solusyonan ang dinaranas natin. At hindi rin sayang ang buhay na nasawi sa pandemya. Halos 3 taon mula maideklara ng World Health Organization, WHO, ang global health emergency para sa COVID-19, ay nananatili pa rin itong isang international emergency. Maaring nasa new normal na tayo. We are living to live with the new virus, But we are not putting our guards down. No? We remain alert, vigilant. Sa huli, tunay na magwawagi ang maagap. Panahon na para isang makabagong Center for Disease Control and Prevention para sa ating bansa. Thank you, Mr. President.
Thank you, Senator Bong Revilla. Mr. President, to allow our colleagues to further study the measure, I move that we suspend consideration of Senate Bill number 1869 under Committee Report number 28. So move, Mr. President.
There being no objection to the motion is approved and it is now suspended.
Mr. President, may I ask for a minute suspension, Mr. President?
Session suspended.